Welcome back to Public Wisdom, true reliable news with your host, Mosey Long. And today we're talking about America's infrastructure. And I bet you never thought of this like this. Medicare is the invisible system we all depend on. When a nation ages, its infrastructure ages with it. And Medicare is one of the biggest load-bearing beings in the entire American system. Today, we're looking at something most people don't think of as an infrastructure at all, Medicare. But make no mistake about it, this program is a structural pillar. It supports 65 million Americans, stabilizes hospitals, and keeps state health systems from collapsing. And this year, the pillar is under more pressure than ever. Medicare's 2026 adjustments bring higher premiums, higher deductibles, and more out-of-pocket expenses for older Americans. Healthcare inflation is running harder than Social Security's cost of living adjustments, which means retirees are losing ground even as they try to stand still. Part B premiums are rising again, driven by medical inflation and the expanding cost of prescription drug coverage. Miss Elizabeth tells me that she used to pay only $50 a month for her prescription, and now it's always up to $130. That's a huge difference, folks. Deductibles to both Part A and Part B are climbing, and the gaps remain. Dental, vision, hearing, and long-term care are still uncovered. Medicare Advantage plans, once the easy button, are tightening their networks. More prior authorization, fewer available specialists, more retirees discovering that the doctor they've seen for years is suddenly out of their network. Prescription costs remain unpredictable. Formularies shift, tiers change, and retirees are left trying to budget for something that refuses to stay still. So what does this mean for America's infrastructure? It means the system is absorbing stress. It means retirees are absorbing cost. And it means the country is leaning harder than ever on a structure that was never designed for this level of strain. Medicare isn't just a health care program, it's a national stabilizer. And when stabilizer weakens, the whole structure feels it. Infrastructure isn't just roads and bridges, It's the systems that keep people standing, and Medicare is one of the biggest. Stay safe, stay aware, and most of all, stay tuned for additional information about your Social Security and Medicare. Thank you kindly.